Welcome to Bloodborne Pathogens training for McDaniel College staff, faculty, and students. Introduction. Approximately 5.6 million workers in healthcare and other facilities are at risk of exposure to bloodborne pathogens such as human immunodeficiency virus, HIV, the virus that causes AIDS, the hepatitis B virus, HBV, and the hepatitis C virus, HCV. OSHA's Bloodborne Pathogens Standard recommends safeguards to protect workers against the health hazards from exposure to blood and other potentially infectious materials, and to reduce their risk from this exposure. Regulatory requirements. The OSHA standard for bloodborne pathogens can be found in 29 Code of Federal Regulations, or CFR, 1910.1030. This standard covers all employees who perform duties that may expose them to bloodborne pathogens. It requires the employer to have a written exposure control plan, or ECP, specific training, and specific record keeping. Who is covered by the standard? All employees who could be reasonably anticipated to come in contact with blood and other potentially infectious materials as the result of performing their job duties are covered under this standard. The term reasonably anticipated contact means potential contact as well as actual contact with blood or other potentially infectious materials. It is important to note that Good Samaritan acts, such as assisting a coworker with a nosebleed, would not be considered occupational exposure and are not covered. Some workers who are at risk. There are many occupations that can be at risk of coming in contact with bloodborne pathogens. Some examples that you may see in a college setting include medical personnel, laboratory personnel, infectious disease researchers, first responders, law enforcement, medical waste treatment staff, housekeeping staff, facility staff, and athletic trainers. The scope of the Bloodborne Pathogens Standard is not limited to only these occupations. The hazard of exposure to infectious materials affects employees in many types of industries and requires caution in all industries. Definitions. It is important to understand a few key definitions before we proceed. Bloodborne pathogens are pathogenic microorganisms that are present in human blood and can cause disease in humans. These pathogens include, but are not limited to, hepatitis B virus, HBV, and human immunodeficiency virus, HIV. Blood, meaning human blood components, and products made from human blood. Occupational exposure is a reasonably anticipated skin, eye, mucous membrane, or parenteral contact with blood or other potentially infectious material, OPIM, that may result from the performance of an employee's duties. Parenteral means piercing mucous membranes or the skin barrier through such events as needle sticks, bites, cuts, and abrasions. Exposure incident is a specific eye, mouth, or other mucous membrane, non-intact skin, or parenteral contact with blood or other potentially infectious materials, OPIM, that result from the performance of an employee's duties. Examples of infectious body fluids. Humans can become infected with bloodborne pathogens through contact with blood or other potentially infectious materials, OPIM. Other potentially infectious materials, OPIM, is any body fluid that could potentially cause infection to you, and you should treat it as such, and includes semen, vaginal secretions, cerebrospinal fluid, synovial fluid, pleural fluid, pericardial fluid, peritoneal fluid, amniotic fluid, saliva in dental procedures, any body fluid that is visibly contaminated with blood, and all body fluids in situations where it is difficult or impossible to differentiate between body fluids. Also, any unfixed tissue or organ, other than intact skin, from a human, living or dead, and HIV-containing cell or tissue cultures, organ cultures, and HIV or HBV-containing culture medium or other solutions, and blood, organs, or other tissues from experimental animals infected with HIV or HBV. The pathogens of primary concern are human immunodeficiency virus, HIV, which can lead to acquired immune deficiency syndrome, AIDS, hepatitis B virus, HBV, hepatitis C virus, HCV. HIV infection and AIDS. Human immunodeficiency virus, HIV, attacks the body's immune system by destroying important cells that fight disease and infection. HIV does not survive long outside of the body, but there is no cure for HIV at this time if you do become infected. However, with proper medical care, HIV can be controlled. In the early stages of HIV infection, some may experience flu-like symptoms, while others may have no symptoms at all. During this stage, cells reproduce at a high rate, and therefore, people are highly infectious. Following the early stages of infection, the disease moves into the clinical latency stage, where cells reproduce at lower levels, but individuals are still infectious. This period can last a decade or longer, but some may progress through this phase faster. Once the disease weakens the body's immune system enough, the disease will progress to AIDS, which is fatal. Hepatitis B virus. The hepatitis B virus, HBV, is more common than HIV. This virus affects the liver and is fatal in a small number of cases. People who carry HBV can pass it on to others primarily through blood-to-blood contact. Hepatitis B initially causes inflammation of the liver, but it can lead to more serious conditions such as cirrhosis of the liver and liver cancer. HBV is a very durable virus, and it can survive in dried blood for up to 7 days. For this reason, this virus is the primary concern for employees such as housekeepers, custodians, laundry personnel, and other employees who may come in contact with blood or potentially infectious materials in a non-first aid or medical care situation. Unlike AIDS, HBV can often be treated successfully. A vaccine is available to help protect you against contracting HBV. Symptoms of the virus usually appear within 60 to 150 days after exposure and include fever, fatigue, loss of appetite, nausea, vomiting, abdominal pain, jaundice, dark urine, and clay-colored feces. It is important to note that sometimes the disease does go unnoticed. Completely healthy individuals can carry the virus, so it is important to consider all blood as a potential risk and use universal precautions. Hepatitis C virus. The hepatitis C virus, HCV, causes infection of the liver. HCV is primarily spread through contact with the blood of an infected individual. Most cases are chronic infections leading to long-term health problems and death, and there is no vaccine available at this time. HCV can survive outside the body, but is not as durable as HBV. Symptoms usually appear within 4 to 12 weeks after exposure and include fever, fatigue, loss of appetite, joint pain, nausea, vomiting, abdominal pain, jaundice, dark urine, and clay-colored feces. It is important to note that sometimes the disease does go unnoticed. As with HBV, completely healthy individuals can carry the virus. Again, it is important to consider all blood as a potential risk and use universal precautions. Exposure Control Plan. The Exposure Control Plan, ECP, requires the employer to identify individuals whose jobs have the potential of occupational exposure to blood or other potentially infectious materials, OPIM. The employer must determine who will receive the training, protective equipment, vaccination, and other protections of the standard. The ECP also describes how the employer will use signs and labels, provide training, provide hepatitis B vaccinations, use engineering and work practice controls, and ensure use of personal protective equipment to protect all employees who could potentially be exposed. Exposure Control Plan. The ECP must be accessible to employees and must be reviewed at least annually to reflect changes in tasks, procedures, or assignments which affect exposure. The annual review must document employers' consideration and implementation of any safer medical devices now in use. Any potentially exposed employees must be allowed to provide input in the identification, evaluation, and selection of engineering and work practice controls. The McDaniel College Bloodborne Pathogens Exposure Control Plan can be found on the portal under the Forms and Policies page. It is important that you read through the McDaniel College Bloodborne Pathogens Exposure Control Plan, as well as the Exposure Control Plan for any institution you are interning or working at. Talk to your supervisor at the institution to find out how to request a copy of their Exposure Control Plan. Knowing what to do if an accident occurs is imperative to your health and protection. How does exposure occur? It is estimated that 600,000 to 800,000 needle stick injuries occur each year in the United States. This is the most common method of contracting a disease in the workplace. Exposure can also occur via contaminated sharps. Contaminated sharps means any contaminated object that can penetrate the skin, including but not limited to needles, scalpels, broken glass, broken capillary tubes, and exposed ends of dental wires. Another method of exposure is contact with mucous membranes, for example, the eye, nose, mouth, or broken skin with contaminated blood. Nurses are particularly at risk as they sustain the most needle stick injuries, mostly during disposal of sharps. Ensure you are following all universal precautions and safe methods. If you have questions regarding your safety, ask before you do. So how can we reduce the risk of exposure? This can be done through universal precautions, signs and labels, work practice controls, engineering controls, personal protective equipment, hepatitis B vaccinations, and of course, more training. We will discuss each of these topics in the next few slides. Universal precautions. Universal precautions is an approach to infection control used to protect employees from exposure to all human blood and other potentially infectious materials, OPIM, by treating them as if they are infectious in all situations where there is a potential for contact with blood, or OPIM. OSHA requires this method to be observed in any situation where there is potential for exposure. To comply with the universal precautions approach, employees should use the proper personal protective equipment, PPE, treat all blood and body fluids as if they are contaminated, clean up and decontaminate the area properly, and dispose of all contaminated material in the proper manner. Biohazard warning labels and signs. Labels and signs must be predominantly fluorescent orange or orange-red, with lettering and symbols in a contrasting color. All containers must be labeled with their contents. Labels must be affixed as close as feasible to the container by string, wire, adhesive, or other method that prevents their loss or unintentional removal. Warning labels and signs are required on containers of regulated waste, refrigerators and freezers containing blood and other potentially infectious materials, and other containers used to store, transport, or ship blood or OPIM. Red bags or red containers may be substituted for labels. Be sure to watch for biohazard warning symbols throughout campus, and if you are conducting work in that area, ask before moving a container labeled as such. Work practice controls. Reduce the likelihood of exposure by altering how you perform a task. When working in labs or designated medical areas, ensure that you wash your hands after removing gloves and as soon as possible after exposure. Never eat, drink, apply makeup or lotion, chew gum, or smoke in work areas. Ensure that you tie your hair back and have no draping clothes or dangling jewelry. Food refrigerators must be marked food only in labs and medical areas, and specimen refrigerators must be marked with a biohazard symbol to ensure all individuals understand the intended use. Work practice controls continued. Ensure you close doors to areas when working with bloodborne pathogens. Use secondary containers when transporting biological materials, and remove gloves and wash your hands before leaving the area where blood or OPIM is housed to ensure any contamination stays within that area and does not contaminate other areas of the building. All sharps should be discarded into a sharps container directly after use. The sharps container should be easily accessible, closable, upright, leak-proof, and not filled past the line on the container. If the sharps container is full, alert your supervisor so it can be replaced. Shearing, breaking, recapping, or removal of contaminated needles is prohibited. Housekeeping. Work surfaces must be decontaminated with an appropriate disinfectant after completion of procedures and when surfaces are contaminated. Use an EPA-registered disinfectant, such as a freshly made batch of 10% bleach solution or Cavicide wipes, to decontaminate any surfaces with blood or OPIM. Wear gloves while disinfecting an area, and be sure to read the directions for that disinfectant carefully. If you have questions, ask prior to use. If you are working at an outside facility, see the facility's policy for proper decontamination procedures. For questions on appropriate disinfectants, contact Risk Management/Environmental Health and Safety. Decontamination procedures. It is important to note that you should only clean up spilled material if you feel comfortable doing so and have all necessary tools to do so safely. If not, contact your supervisor for immediate response. If your supervisor is not available, contact campus safety for assistance. If there is a spill or an area becomes contaminated, first ensure you are wearing the proper personal protective equipment, or PPE. Depending on the size and nature of the spill, this could include gloves, lab coat, safety goggles, face shield, and shoe covers. Next, make sure you have all the appropriate tools to safely decontaminate the area. Tools may include a bloodborne pathogens spill kit or individual materials such as a biohazard red bag, a sharps container, tongs or forceps, paper towels, and disinfectant. Carefully use tongs or forceps to pick up any sharp objects and place them directly into the sharps container. If there is any equipment that is contaminated, place it on a paper towel out of the way of the spill. Cover the affected area with paper towels or other absorbent material and spray the disinfectant on the absorbent material. You do not want to spray the disinfectant directly on the material, as it could splash up at you and cause exposure to you. Allow the disinfectant to sit for a minimum of 15 minutes. Wipe up the area cautiously using the tongs or forceps and place all spill cleanup materials directly into the biohazard red bag. Decontaminate any tools and equipment using the disinfectant and let sit for 15 minutes to ensure the bloodborne pathogens are destroyed prior to continuing the cleaning process. Dispose of any used PPE in the biohazard red bag and wash your hands. Report spills and contamination to your supervisor. Appropriate disinfectants include freshly made 10% bleach solution or an EPA-registered antimicrobial or tuberculoside disinfectant. The lists of these EPA-registered products are available online on the EPA website. Cavicide disinfectant can be found in many of the McDaniel labs. Engineering controls. Engineering controls reduce the chance of employee exposure by either removing the hazard or isolating the worker. Examples of engineering controls include sharps disposal containers, self-sheathing needles, biosafety cabinets, and safer medical devices. Employers are required to select and implement appropriate engineering controls to reduce or eliminate employee exposure. When exposure still remains after engineering and work practice controls are put in place, personal protective equipment must be used. If there are any issues with engineering controls, stop work and report the issue to your supervisor. Diabetic needs. Students living on campus who use needles or sharps for medical reasons, such as diabetes care, should contact the Wellness Center for assistance with safe and proper disposal. Safer medical devices. The Centers for Disease Control and Prevention, CDC, estimates that 62 to 88% of sharps injuries can be prevented by using safer medical devices. Two examples of safer medical devices are needleless systems and sharps with engineered sharps injury protections. Needleless systems are devices that do not use needles for the collection or withdrawal of bodily fluids and for the administration of medication or fluids. Sharps with engineered sharps injury protections are a non-needle sharp or a needle device used for withdrawing body fluids, accessing a vein or artery, or administering medications or other fluids, with a built-in safety feature or mechanism that effectively reduces the risk of an exposure incident. Personal protective equipment. Personal protective equipment, or PPE, is specialized clothing or equipment worn by an employee for protection against infectious materials. Examples include gloves, goggles, gowns, face shields, mouthpieces, and resuscitation devices, and more. Personal protective equipment continued. When there is potential for occupational exposure, PPE must be provided at no cost to the employee to prevent blood or OPIMs from passing through or contacting the employee's work or street clothes, undergarments, skin, eyes, mouth, or other mucous membranes. The employer must ensure that appropriate PPE in the appropriate sizes is readily accessible at the work site or is issued to employees. Hypoallergenic gloves, glove liners, powderless gloves, or other similar alternatives must be readily accessible to those employees who are allergic to the gloves normally provided. Personal protective equipment continued. General rules for use of PPE. If you do not use your PPE properly, it is not fully protecting you from exposure. It is important that your PPE fits properly and you check it routinely for flaws or damage. Never use PPE that is damaged, as it will not protect you. PPE must be properly cleaned, laundered, repaired, and disposed of at no cost to the employee. Remove your PPE as soon as possible if it becomes penetrated by blood or OPIM, and wash that area of your body immediately. It is important that you always remove your PPE and ensure you wash your hands prior to leaving the area of contamination. For questions on proper PPE for specific work, Contact risk management/environmental health and safety. Regulated medical waste. Regulated medical waste must be placed in closable, leak-proof containers built to contain all contents during handling, storing, transporting, and shipping, and must be appropriately labeled or color-coded. Regulated medical waste contents include liquid or semi-liquid blood or OPIM, contaminated items that would release blood or OPIM when compressed, items caked with dried blood or OPIM that are capable of releasing such, contaminated sharps, and pathological and microbiological waste containing blood or OPIM. Contact risk management/environmental health and safety for any biohazardous waste questions. Hepatitis B vaccination requirements. The employer must make the hepatitis B vaccination available to all employees who have the potential for exposure to bloodborne pathogens within 10 working days of initial assignment. The vaccination must be free of charge to the employee and given at a reasonable time and place unless the employee has had the vaccination, antibody testing reveals immunity, or the employee signs a declination form, which will be discussed on the next slide. The vaccination must be performed by a licensed healthcare professional. All McDaniel employees receive the paperwork for the hepatitis B vaccination within their new hire paperwork. Contact Human Resources with any questions. Hepatitis B vaccination requirements. The hepatitis B vaccination must be provided even if the employee initially declines to have it, but later decides to accept the vaccination. Employees who decline the vaccination must sign a declination form. Employees are not required to participate in the antibody pre-screening program to receive the vaccination series. The vaccination booster doses must be provided if recommended by the U.S. Public Health Service. HBV declination form. The hepatitis B declination form can be found in the 29 CFR 1910.1030 Appendix A. This form cannot be altered and must be signed if an individual declines to receive the vaccination. The form reads, "I understand that due to my occupational exposure to blood or other potentially infectious materials, I may be at risk of acquiring hepatitis B virus, HBV, infection. I have been given the opportunity to be vaccinated with hepatitis B vaccine at no charge to myself. However, I, name of individual, decline hepatitis B vaccination at this time. I understand that by declining this vaccine, I continue to be at risk of acquiring hepatitis B, a serious disease. If in the future I continue to have occupational exposure to blood or other potentially infectious materials, and I want to be vaccinated with hepatitis B vaccine, I can receive the vaccination series at no charge to me." Emergency exposure procedures. If you are exposed to blood or OPIM, you should follow these steps to reduce your chances of infection. Step 1. Wash the exposed area thoroughly with soap and running water for at least 15 minutes using non-abrasive, antibacterial soap if possible. Do not use abrasive soap, as this can rupture the skin and cause further infection. Step 2. Remove all contaminated clothing carefully and place it into a bag. Rewash any area that may have touched the contaminated clothing. Step 3. Report the incident to your supervisor. The supervisor should contact Human Resources to report the incident immediately. Human Resources will call Carroll Occupational Health to make them aware that the individual is coming. Go to Carroll Occupational Health for treatment. Contact Campus Safety for transportation needs to Carroll Occupational Health. Step 4. Human Resources will provide the employee with a copy of the McDaniel College Bloodborne Pathogens Exposure Control Plan and any additional paperwork. Step 5. The medical provider at Carroll Occupational Health will evaluate you to determine the exposure severity and best course of action for follow-up to the exposure. Emergency exposure procedures continued. Step 6. The medical evaluation will contain such elements as documentation of routes of exposure and how the exposure occurred, identification and documentation of the source individual unless the employer can establish that identification is not feasible. With the source individual's consent, the medical provider will also determine that person's HIV and HBV status through blood testing, unless the source is already known to be HIV or HBV positive. You, as the exposed individual, will be informed of the results of such testing. If you, as the exposed employee, consents, the medical provider will test your blood for HBV and HIV. Emergency exposure procedures continued. Step 7. You will receive post-exposure treatment when determined appropriate by the medical professional. This may include risk counseling, as well as treatment for disease when medically indicated. Step 8. Fill out a report of injury found in the exposure control plan on the McDaniel portal with your supervisor and send this to Human Resources within 48 hours of the incident. If your supervisor is not available within the 48-hour period, send the report directly to Human Resources, who will follow up with the supervisor. The incident will also be reported to the Director of Risk Management/Environmental Health and Safety. Step 9. The last step is to determine if any additional steps are needed to follow up on the exposure. If appropriate, Risk Management/Environmental Health and Safety will conduct an assessment review related to the injury and/or exposure. Following an exposure incident, Human Resources must provide the healthcare professional with a copy of the standard as well as the following information: a description of the employee's duties as they relate to the exposure incident, documentation of the routes and circumstances of the exposure, the results of the source individual's blood testing if available, and all medical records relevant to the appropriate treatment of the employee, including vaccination status. The healthcare professional will provide their written opinion of findings to Human Resources and a copy to the employee within 15 days of the evaluation. Medical record-keeping requirements. Human Resources is responsible for the establishment and maintenance of medical records. Medical records must include employee name and social security number, hepatitis B vaccination status, post-exposure evaluation and follow-up results, healthcare professional's written opinion, and any specific information related to the exposure incident. Medical record retention. Human Resources will ensure that the medical records are kept confidential and are not reported or disclosed without the expressed written consent of the employee. Medical records must be kept for the duration of employment, plus 30 years. Medical records must be available to the employee upon request and must be available to authorized persons. This may include representatives from the Occupational Safety and Health Administration, or OSHA, and the National Institute for Occupational Safety and Health, or NIOSH. Sharps Injury Log. The requirement to establish and maintain a Sharps Injury Log applies to any employer who is required to maintain a log of occupational injuries and illnesses under OSHA's record-keeping rule. McDaniel College does maintain a Sharps Injury Log that documents any Sharps injuries that occur on campus. Refer to the emergency exposure procedures found in previous slides for steps to follow in the event of a Sharps injury. The purpose of the Sharps Injury Log is to aid in the evaluation of devices being used in the workplace and to quickly identify problem areas in the facility. It must be reviewed at least annually during the review and update of the exposure control plan. The log must be maintained in a way that ensures employee privacy. If the data is made available to other parties, for example, supervisors, safety committees, employees, Any information that could be used to identify the employee must be withheld to protect the employee's privacy. Training requirements. Training must be provided at the time of initial assignment to any individual with potential for occupational exposure and at least annually thereafter. Additional training may be needed when existing tasks are modified or new tasks are required, which affect the worker's occupational exposure. Training records must be maintained for 3 years from the date of the training occurred. It is important that you are cautious when working in any environments where there is potential for exposure to blood or other potentially infectious materials. Rules to live by. Always follow universal precautions. Treat all blood and body fluids as if they are contaminated. You have reached the conclusion of this training. Thank you for participating. Please contact Ethan Harden if you have any questions or comments regarding bloodborne pathogens. Contact information can be found on this slide. The McDaniel Bloodborne Pathogens Exposure Control Plan can be found on the portal under the Forms and Policies page. Please review this document and then proceed to the quiz. You will be allotted 2 attempts to receive a passing score of 80% or higher on the quiz. Please contact Ethan Harden if you do not pass the quiz.